Hi everyone, we're back with Dr. Jochen and our superstar Ginger Jeffries. We're so excited to have you.
I am so happy to be here. The funny thing is when I walk in, people are like, and I introduce myself, they go, "You don't look like Ginger Jeffries." That's because I haven't been to Dr. Jochen and his potions, and I need him to make me look like Ginger Jeffries again. So
we are taking Ginger Jeffries back to the future. Or wait, back to the past?
Yes.
I don't know, but we're about to do that right now with Dr. Jochen, and he's going to do some fillers in the face, and he's also going to move down and do some work in the neck. Is that true, doctor? And then a tall tale sign of aging is also the hands. So we want to make sure that Ginger also has hands to match her face and neck. So
you know, it was sad. The first time I looked down and I saw my mom's hands. And I thought, when did these happen?
So
it's always better. You know what happens as you get older is you start to lose your vision. And I never look at myself with my readers on. Because when I do that with my readers on, it's like a disaster.
Okay, but your hands look wonderful.
But can I tell you something? How many fillers I have in my hands?
That's the difference. Look at mine, look veiny. And look at it, it's like the.
You're going to be so happy because we're going to put a little filler in here. It's going to take 10 years off those hands.
I would never have known
10
that.
years.
And this neck thing that you're doing too, this is super exciting.
Because
we were talking about this. Everybody looks here. We focus on here and here and here. And we don't look here. And it wasn't until I was working with cameras that don't have beauty chips.
Oh, no. Where do you get those cameras with beauty chips? That's what I want to know.
No, nobody needs to know. And I saw my neck for the first time for what it really is. So
I love it.
We're going to do something.
Are you talking about filters? Because I really want to be in on this camera thing.
No, these are, filters.
Okay,
That's what we'll call them,
filters. Okay. So today we're going to do a little bit of tweaking here with Ginger, who's gorgeous to begin with, right? I mean, she looks amazing. So what we're talking about is there anywhere on your face that concerns you?
This down here, I feel like my face has fallen. I remember I was at a luncheon and you said in our 20s our faces are like triangles.
Triangles, yes.
And when we're not in our 20s anymore, because some of us aren't, our faces turn like this. And I see that. I legit see it's all come down here. So I've lost all volume up here. And I feel, if I were really thin, gone. So that bugs me. This bugs me a lot. And then the eyes. It's like you almost don't want to smile because, your eyes disappear.
Yes.
Here's a pretty look.
Yeah, I think that's hilarious. I'm looking at my face in this thing, and I'm going, I need to get a better angle here.
Look at you. You're close to the light.
I know, right? It's not helping me at all. So anyway, your face is gorgeous, and I think you're being super hard on yourself because you really are really beautiful. But we're going to do just a little tweaking. We're going to add a little bit of volume here. We're going to soften these lines here. We're going to do a little bit of improvement around the mouth here, and we're also going to give a little definition to the jawline. And then, as Ginger said, we're going to focus on the neck just a little bit. And by that, what I mean is we're going to do some work on the bands on the neck.
This is how much I love him because I'm letting you zoom in on these parts that bother me. Is there a Snapchat filter on this button?
That's the after photo.
Oh, good, yeah. That's what you do. You are a Snapchat filter. I have Dr. Jochen and his potions, but now he's going to turn me into a Snapchat filter.
Okay, so I'm going to work on this side here.
When I was out front, too, people were asking me if this hurts. They do, what do you guys do on the face? You do the Lanacade?
The lidocaine, yes.
I don't have any of that done. It doesn't hurt.
It's really not that bad. A lot of people say it. So we're going to work on the cheeks because everybody likes to have really nice, smooth, round cheeks. Now, we have a couple people watching. If you feel like you can see better in different angles, feel free to move around. So, okay. So don't
they
feel
also
like
ask me what this stuff is, this filler.
And this is hyaluronic acid. Hyaluronic acid is naturally occurring in our bodies. We have it in our eyes and in our skin and also in our joints. So it's just a little bit of a gel. And you can see if I put it out here, see it looks like a clear gel. And I'll just put a little bit right there.
And one thing I noticed, the last time I did this was, do you want me to talk or not?
Sure, I want you to talk as much as you'd like.
So the last time I did this was December 2016. And my skin is better than it was back then because whatever this hyaluronic acid is, it actually draws collagen and helps to produce collagen. Is that right?
Yes. Well, the study showed by the volume itself, it can actually stimulate the fibroblast to produce collagen. So you're absolutely correct. And see how smart she is? She's not only pretty, but she's really smart too.
I pay attention. I pay attention.
Ginger was telling me a story. Can I tell the story about you being down in San Diego and how you're like the amazing one who is
yes,
not only beauty but brains.
I
love it.
Yes. And just keep in mind, you know, the first rule of journalism is consider the source. I'm the one telling Dr. Jochen that I'm the amazing one with brains and beauty.
And you're also convincing because I believe every little bit because I know it's all true. It's all true.
Listen, I did weather in the desert for 25 years, so I had to convince people, you know, that it was wonderful. And it is. It was so nice coming back here and enjoying the warmth, but at the same time, you know, you got to protect your skin too.
Yes, and you're doing a great job with it. It looks great. Okay, so that's just a little boost to the cheeks. So we got a little bit of a lift there.
So I have
which
cheeks
I love.
again?
Yes. And now we're going to soften these nasolabial folds. And we're using this product called Define. Define is great because it's elastic. And it actually starts to integrate into our tissue after it's been injected. So it looks natural. It keeps our faces looking super natural. I hate to keep using that same word, but some of the old fillers would look artificial, and I wouldn't say necessarily plastic, but they made the face look a little bit swollen, which is not a look that was attractive.
No, we do that naturally. We swell our faces on our own.
Okay, and we just want to soften these lines here. In the old days, this was the only place people would fill, and what would happen is this would start looking more and more swollen and look very, very artificial. So there we go. How are you doing?
No, I'm great. I just didn't want to talk because you're working around my mouth. But I remember I came to you one of the very first times and I said, I don't want that monkey mouth look. You know, when it's all like protruding. And you said that was the way people were doing fillers, making it protrude and to try and get rid of lines, give you volume, but it wasn't the way you do it.
Yeah, it wasn't really looking natural. So what we found was by putting more filler in the cheeks, it gave a more natural look. And I'll sort of demonstrate on you here in a second. Now we're doing a little bit of voluma just to make the jawline come back. Because one of the things that happens with birthdays is the jawline starts to disappear. And so by putting just a little bit of filler here, it softens it and creates a more youthful appearance. Now we don't want to overdo it. Go ahead, Ginger.
Yeah, and you know, you showed that picture of Marilyn Monroe. I remember this too, where we want our faces to be symmetrical, but our faces aren't symmetrical. And you cut Marilyn Monroe's face in half, and you put the same face on the other half, and she looked hideous. And I think that's one of the key things, because I know you've done more in the past, you've done more on one side than the other, because one side needed it, or one side, for whatever reason, is higher or lower, or whatever the way that, you know, God made my face. And then Dr. Josh came in and made it better.
Yes.
You know, that's the other thing, that our faces aren't symmetrical.
Exactly. And a lot of people want to make their faces symmetrical, but the thing you're talking about is if you look up famous people's facial symmetry, you'll see that they cut the faces in half, and you'll see that one side of Marilyn is skinny and then the other side is fuller. And if you use the skinny side, she doesn't look attractive, and if you use the full side, her face looks too chunky. And so a lot of people, when they say, I really want to be symmetrical, you don't necessarily want to chase that symmetry, because if you do, what's going to happen is you're going to make your face look too full and too fat. So we like to keep one side a little bit skinnier, not necessarily get 100% symmetry.
And that's when I think you really get that plastic look, that flat look, that you start to lose your look.
Exactly.
Which, I mean, I'm not trying to look 30. I'm not 30. But I'm not trying to look tired either.
Would you hate it if we made you look 30, though?
No. Can I have a 30-year-old butt? Can you do that too? The face is fun and games, but let's be honest.
I don't know. Your figure looks really nice, I would say.
Well, that's because I live here. I also did the Medi weight loss.
Yes, and I'm so sad we don't have that anymore, because it was such a great program. I loved it. Do you still use any of those principles from the Medi weight loss?
100%. I still buy the shakes.
Oh, you do? Love that. So now what we're doing is we're just trying to make sure that the chin looks youthful and fresh, and then we're trying to clean up some of these fine lines in here. And it's looking really good. And you can see Ginger's one of our superstars. Not only is she good with a needle, but she also is not bruising. You know, because that's one of the things that drives people crazy is if you get a lot of bruising.
Which is great since she has to be on TV tomorrow.
Really? I did not know that.
Don't tell him that.
Is your boss going to be mad if you come out with a couple bruises?
Mm-mm.
You could do a...
We have makeup. There's no worries.
You guys have the good stuff, too.
Mm-hmm.
Okay, how are you feeling?
Great.
Great. So we just
It's
did
more
a
important
little...
how you're feeling. Do you feel like you're having a good day?
I'm feeling excited. I'm excited that you're here. Because you're my superstar.
Mm-hmm.
And you like to talk about it, which always gives me
I know. I get paid
joy.
to talk. You can't shut me up.
Okay, so that looks good. So now let's see here. So now we're going to do a little bit of a bump to the lips, just a little bit.
Oh, we've never done this. What's
You've not
this?
done that?
Mm-mm.
Okay.
You've never done
We're
anything.
just gonna give them a little bit of a pop, not to
Okay.
make them look big,
Oh,
just to
boy.
make them look a little bit fresher. Is that okay with you?
My face is in your hands.
Okay.
You know that.
Love it, love
I
it.
don't tell you what I want. I tell you. Now, will this hurt? I've heard
This part
lips
is
hurt.
going to hurt, yes.
Okay.
But if you can, the way you've been doing with the rest of your face, this is not going to be any big deal.
Okay.
Okay, I just want to give a little eyebrow pop too, just a little bit. And everything is just softening, not making it look exaggerated, just softening. A lot of people really like this because it gives the brows just a little bit of a lift. And people don't realize as you get older, the brows start to look like skin on bone. Whereas if you look at youthful eyes, there's a little bit of a pad between the skin on the bone.
You know, I've seen some people too do a lot of Botox up above the brows, and then that just makes their eye droop, and you get that big, crease almost on the eye.
Yes, you have to be super careful with overdoing the Botox because it could make you look worse as opposed to better.
And Botox is so cheap, and I mean it's addictive in that manner. You want to go do it, but your results are so spotty, and they go away so fast. I'm just such a fan of fillers. Again, the last time I had this done was December of 2016, so that says a lot.
Yeah, it's really held on nicely. But one of the things that I think is great about you too is you have a really good lifestyle too, though. Or is that not true?
No, it's
I was going to say, you look like you're somebody who takes time to go to the gym and you're careful with what you eat and all that, I would say.
No, that's true. I don't get enough sleep and I drink like a fish. But other than that, no, I'm just kidding. Not that bad. Not that bad. Just on girls' weekends.
And as you should. Okay.
That's how you preserve.
Exactly.
Okay, if I have anything up my nose, you're going to have to tell me. Because
You have nothing on your nose.
Up my nose.
Up your nose. Oh, I'm the king of that.
Okay, so what do I do here? This is brand new for me.
Okay, all you have to do is just sort of keep your mouth parted like that.
Okay.
And just a little bit open, and here we go. Now, like I said, I'm the king of natural looks, so you don't have to worry about being overdone. But God was good to you because you have beautiful, beautiful lips to start with, so that makes my job easy. And I only get to say that to a select few people. So you can see between this lip and this lip, if you look, it's just a little bit fresher, but not crazy. Do you guys see that? Can you see that over there? Just a little.
I can see over there.
Right? Do you see the difference? It's just a
I look
little
like I
bit.
just went a couple of rounds with Ronda Rousey.
Who's Ronda Rousey?
What?
Is she one of those female wrestlers or something? Is she famous? Maybe we can get her in here next. Do you have any connections?
Hey.
There we go.
I don't want to talk. I don't want to mess it up.
Okay.
I feel like I put one of those lip enhancers.
Kylie Jenner's lip plumper, right? Kylie always gets excited when we bring up the Kardashians.
Oh yeah, they're realistic.
I just wonder what they really look like because I think they're always or what do they call it now? Photoshop.
Filters.
Filters. Yes. What do people really look like these days? Thank God for filters. I have to learn how to use them.
You don't need them.
No.
So you're using different filters based on what area you're injecting? Right?
Yes, we do. You know, I have a couple go-tos in my life, and now do you see? Can you see that, Ginger? Take a look over there, and just see how nice it looks. Can you see that?
Oh wow!
It's looking great.
Okay, so it's lumpy right now, but that's gonna.
I don't think. Well, I think I gave you a bruise right here.
Oh,
so that's why that's a little bit. Yeah. A little bit of a bruise.
That's what I say. Well, hey, how many of these have you done and you're just now getting one bruise?
So
I gotta tell you, with these videos, your pimple popper ones, or when you're abscessing one, man.
We need
That really gets me.
You like those?
No. It's like I have to know because I always tune into your live stuff, and when you're doing an abscess, I'm like, I can't be around a meal.
Okay, so the lips are great except for this little bruise that we gave Ginger here, but it looks great. Just a little bit of a bruise. Not bad. So let me get over here.
Oh, that's not much at all.
That's not much at all, right?
No. Look at how, you are so...
Look at that. So, I just want to review what we've done so far before we start putting in Botox. So we put a little bit of filler here to just soften this up a little bit. Can you see that? Okay, so then we put a little bit in the nose to soften that up. We gave a little bit of a cheek lift here. We've done a little bit along the jawline to smooth it here. Then we've softened these lines here, gave her a little bit of lip pop except for that bruise right there. And then same thing over here. We just did a little lift here, a little bit of jawline work here, and just a little bit in the chin to smooth it all out.
And you know, you were when you put something in my chin right here, that was another time where I really saw a big change right here in my face.
Yep. No, it works great. So next we're going to move on to the hands. Did they wipe your hands down?
Yes.
Okay, so we're going to move these down here.
Not that.
Sorry about that.
How's it looking? I've got a friend in here. Yeah?
Doesn't it look good? It looks amazing, right? Yeah. No, and it just looks like you. It doesn't look it doesn't look fake or weird or anything. So now I need a little bit of lidocaine, please.
Except for I feel super sexy with my lips right now. I gotta tell you.
You look like somebody. You look really like somebody thought they were sexy and bit your lip, maybe. They got a little too excited.
Okay, I've got one of my best friends in the room.
And what'd she say?
She's known me for 20 years, and she goes, "You look like you look when I met you."
Oh, I love that.
How sweet is that?
Oh my God,
and
that's
that
great.
was when, let's see, we just had our first kids at that point, right? So this was when we were still well rested. It was, it was before teenage years. It was,
And stress.
Well,
yeah, I was actually watching her child in the nursery at Southwest Church.
Yep.
And then we decided, I think,
Where's
didn't
the
you
needle
leave and you're like, we're going to be
this?
friends or something like that.
Oh,
This
thank
is
you.
fun with the lips. Do you want to, come touch my lips? Right?
Who are you asking? Are you asking the audience? Or are you asking? Is there
I'm restraining myself.
Okay, so here we go. So first thing we do is we're going to use cannulas in the hands. And the reason I like cannulas in the hands is because I really don't want to bruise this area. I don't use the cannulas in the face unless people request it because it allows me to be very precise on where I'm placing the fillers. But in the hands, I really want to try to avoid bruising as much as possible. So it really does make a difference.
And that's what a cannula is?
That's a cannula right there. I might have bruised you anyway.
That's okay.
Okay, so now we just slide the cannula in, and then what we're going to do is we're just going to start filling.
Oh, wow.
Isn't that fun?
See that?
Yeah.
How do they think of this?
All right.
Does it move into the right place then when you inject it?
Yes. So what this is called Juvederm, and I also like to call it Moviderm a little bit because it moves really nicely into the place you want it.
I have your lips now.
So then we're just sliding it in where we want it, and then we'll just massage it in a little bit after we're done. Now, how's the pain with this, Ginger?
That's no problem.
Not bad, right? Because that's one syringe.
Don't hurt the lips day, you feel that, but it's nothing more than like giving blood. So if you've donated blood, you know what it's going to feel like. And now, I mean, it's in an area, it's not even as bad as biting your lip, I would say. The nose always makes me either sneeze or like have a tear, like a reactive tear, but it's not a painful tear.
But Ginger, you have a pretty good pain tolerance.
I do.
You know, when we're not doing a demo, we'll actually use other tricks to try to make sure people have more.
Okay, what about you do this little thing when you do Botox where I call it sleight of hand, because you have that little vibrator thing that you have on one part of the head, and then you're putting in the very first time I came to see you, and I said, you know, my good friend Libby Bobian, who told me at like 30 something, she's like, get rid of that angry line, you know, you want to do that. And so I came to see you, and you had this vibrator thing going on my forehead while you were poking in the Botox, and it was like distracting my nerves. So you're like,
one more place.
So you had this going here, and then filling
short.
or poking here, and I never felt anything from that as well. So I think it's called I call it sleight of hand.
We call it a vibrator, but you can call it sleight of hands if you want.
Well, it sounds funny that you're putting a vibrator on my forehead, but
I know.
That's okay. It's okay, Tim.
One of my favorite comments was one of my patients. She's a female, and when we were done, she looked at the vibrator and she said, "Oh, no wonder it felt so comfortable," which made me laugh. Yeah. Okay, so now what we're going to do is this looks a little bit bumpy. So the nice thing about Juvederm is it just moves into place. So that's why I call it Movederm. So it may look a little bit lumpy for a couple minutes, but by the time we're done, make a fist. There we go. And then we're just going to smooth it in like this.
Wow.
And you're going to be so happy because your hands are going to look so much better with this product. But they won't look fat. You know, one of the things that people like to put in here is fat, but I think it makes it look like you have fat hands. Whereas with Juvederm, you're going to have a little bit of swelling, but in a couple days, the swelling's going to go down, and you're just going to look like they're rejuvenated, not fat.
Is that why the name is Juvederm? Like it rejuvenated?
Yep, there we go.
Look at that. That's crazy.
That versus that. And keep in mind, it's still a little bit swollen, so it's going to look better and better and better over a couple days.
Look at the veins.
But look at the difference. Isn't that great?
Yeah, this is... And okay, so now with Juvederm, because you were able to move it around, do I need to be careful with this?
Not at all. No, because you want it to slip around into place. So this is great. And sometimes if you're a little bit lumpy, you can even sit on your hands a little bit. So, but see how nice that is compared? It's like amazing. Dramatic, isn't it?
Yeah.
So now we're going to do the other hand. And this, believe it or not, is not that painful. You know, some people think that this is going to be painful, but it's really not bad at all.
Do you really think I have a high pain tolerance?
I do, because most people would be whining a little bit more than you have. Yes.
You know what? I maybe I do, but I think about the end result. I get excited about this. I know in a matter of minutes, you take off years. That is way more exciting than a little. It's a pinch. It's a pinch.
Right. I always get a little bit of a high from it.
Do you?
I really do. From getting cosmetic procedures, I get a little bit of a high.
You get excited. You know what? Who was I talking to? I think it was you. And I forgot your name. Brenda. Okay. One of the things that I love so much about Dr. Jochen, and Brenda and I were talking about this when she was doing my pictures, is you actually really care about your clients. You get to know us, you know our lifestyles, you know what we need. So you're not just like creating these cookie cutters, because we all don't. I have a different job than Brenda, than Andrea. And so I love the fact that you tailor the things that you do to my needs as a patient. And you get to know me as a patient, as a friend.
Well, that's the fun part of my job, is I get to hear all of my patients' interesting lives. Because everyone has a great, like you have a great life, yes.
Hi. And you don't have one foot out the door like most doctors.
Oh, yes.
We'll hunt him down. Even though I do want him to open an office in San Diego. I mean, you need to be there. San Diego needs you. Carlsbad needs you.
They have to come here.
True, and this is not a bad thing. This is not a bad thing.
You can see we're just putting it different areas around.
This?
Yeah.
Look at that.
Okay, so we just get it in there, and now go ahead and make a face, or fist again, a face, make a face. Make a happy face. There we
No,
go.
I want to make a French pout. That's all I want to do.
Oh, I love that. I want you to
pout
practice
on it.
that on camera so we can see your French pout.
Straight up.
And you see what's nice about the Juvederm is it looked a little bit lumpy, and this is the one filler where I don't have to worry if it's lumpy. The other ones you have to be very precise because where they go is where they're going to stay. But in the hands, okay, go ahead and stretch out your hand.
Look at that.
See how nice that is? And there's
wild.
really no bruising at all.
You
And
were
they
worried
look.
that you were bruising me. No.
And so this is going to get better and better and better as the swelling goes down.
And you get a hand massage. Which is not a bad deal.
Is this the best hand massage you've ever had? That's all I want to know. Probably
How
not.
long does it generally last?
This will last for 6 months, typically. Now, the last thing we have that we're going to be doing
The
is...
last time I got my fillers done, though, was December of 2016.
See how nice that looks already? Isn't
Yeah.
that great?
So if you... I don't know. I'm a fan of spending the money on the better fillers because they last.
And, you know, the technology is so much better with the newer fillers. You know, they look natural. They don't swell. That was one of the problems with the older fillers is they'd swell. And now with these fillers, they really don't swell.
Was that like Restylane or whatever?
It was more Juvederm and then a little bit with the Restylane. Okay, so we're just putting a little bit. Raise your eyebrows up high for me, please. Okay, and scrunch down really hard. So we're doing the bunny lines, we're doing the crow's feet, we're doing the chin dimple, and then we're going to do her neck lines. So now, show me your bottom teeth really hard, and you'll see these bands. I love that sound.
Yes, I see the band.
Okay, and then we've got a band over here. We're injecting the Botox, or Dysport, excuse me. And it's, to me, they're interchangeable. And that's all there is to it. So, Ginger got the works today.
Yes.
And let's just count. The reason I'm going to count here is we did 2 voluma in the jawline. Okay, we did 1 syringe in the lip. We did 1 syringe in the folds here. We did 1 syringe here, 1 syringe here, and 1 in the jawline. So I think that was about 1, 2, and then 4 in the hands. So people worry that they're going to be looking artificial and fake by doing too much filler. And so one of the things I like to tell people is 1 syringe of filler is only 1/5 of a teaspoon. So a little bit, it's just a very little bit. So it's really hard to make people look unnatural with these fillers.
Oh, I'm so excited. I can see over there.
Don't you look great? Look at that.
You know
You're
what?
camera ready. Look at that gorgeous face. Oh my gosh.
I just feel like everything just got moved up. Everything just got moved up. I can see it immediately. I'm excited to see the pictures from before, but yeah, I feel rested once again, and I don't know if you've got beauty chips going on. But
No, that's you. That is
I'm
you.
super excited.
Okay, thank you so much.